Welcome back to another episode of Cable Chatter. Thanks for making us a part of your day. We appreciate you jumping in and catching up on what's going on in Randolph County and this area. And it's just a lot of fun to host this myself. It's good to kind of be in here and share what's going on and the news and the information that we can find. And I'm here doing Cable Chatter to kind of spread some information about what's going on, because my grandma told me that she didn't know what was going on in Randolph County, and so here I am trying to pick up where others have been before. The Rick Clear and John Schmidt and Nick Poling, who have done this show before me, so I'm hoping I'm doing all right in their eyes. But we do have some community announcements before we get started today. Friday, September 3rd, the Levi Driscoll Band will be at Goodrich Park from 7 to 10 p.m. Friday through Monday, September 3rd, 4th, 5th, and 6th, the Labor Day Softball Tournament will be in Goodrich Park. On Saturday, September 4th, Andy Studi Band will be at Goodrich Park from 7 to 10 p.m. The Circle X Fun Show will be from 8 to 3 p.m. On Saturday and Sunday, September 4th and 5th, the King of the High Banks at the Winchester Speedway. Super late models, sprint cars, modifieds, Vors compacts, and more. Gates will be open at 10 a.m. each day. Thursday, Friday, and Saturday, September 9th through the 11th, the Lynn Lions Fair, tractor pull and food trucks. So go out and check that out. On Saturday, September 11th, in Ridgeville, there'll be a community event in honor of 9/11. Saturday, September 11th, the second Saturday market will be occurring in downtown Union City. On Wednesday, September 15th, there'll be a free movie at the Town Square Cinema for seniors at 1 p.m. to 3 p.m. Friday, Saturday, Sunday, September 17th, 18th, and 19th will be the U.S. Highway 32 yard sales. On Saturday, September 18th, the John Beatrice Band will be at Goodrich Park from 7 to 10 p.m. Saturday, September 25th, the Big Ginger Band will be performing at Otterson Park from 7 to 9 p.m. On Tuesday, September 28th, there'll be a senior seminar at the Farmland Community Center at 12:30 p.m. RSVP is required. Every Monday, the 6th, 13th, 20th, and 27th, there'll be a music jam at Historic Farmland from 6 p.m. to 8 p.m. And every Saturday, 4th, 11th, 18th, and 25th, the Winchester Farmers Market will be on the downtown square from 9 a.m. to 1 p.m. And I'm sure there's a lot more going on in Randolph County in September, so I encourage you to take a look on Facebook, check the RCU website and the things they're sharing, and just go around and see what's going on. Today I have with me Dr. Ken Sowinski. He is the Randolph County Health Officer, and I figured with the state of events and what's going on, it was about time to have a conversation about COVID. And we're going to do our best to just get the facts, because there's a lot of different information out there. And I've known Ken for a long time, and I know that he's a very fact-based individual and looks at the data and does the best he can to give information as unbiasedly as he possibly can. And so I guess, Ken, you want to tell us a little bit about yourself before we get into the meat of the matter?
Sure. Thanks for having me, Blake. I've been in Randolph County since 1995. My wife and kids, all of my kids have come up through the Randolph Eastern School Corporation. And I've been the health officer of Randolph County now for about the last 10 or 11 years.
That's awesome, and I know we appreciate what you've been doing. And I know the last year and a half have been harrowing, probably to say the least.
Yeah, it's been a busy time taking my part-time job and making it a full-time job on top of my other full-time job.
I'm sure. So let's talk about COVID. Like I said, there's a lot of different information. So what are kind of the essential facts?
Well, COVID is caused by a virus, and it's caused by a coronavirus. There have been other coronavirus epidemics. There was a major one in 2003. However, the 2003 coronavirus epidemic didn't hit the United States. I think there was a total of about 8 cases at that time. What makes this COVID different is that it is a much more contagious virus, and it hit the United States and it just took off. So we all know about that, and we know that it hit around January of 2020, and what it's done. Anybody who's watched the news knows about that. This coronavirus is called SARS, S-A-R-S. That stands for Severe Acute Respiratory Syndrome, and that's a description of what it does to people. It causes severe respiratory problems. The problem with COVID is that it can take many forms. It can just be a mild cold, a runny nose, a little stuffiness, congestion, minor cough, low-grade fevers that doesn't feel any different than any other flu or cold that we would get. But in a significant number of people, it takes over the lungs, or it takes over other organs. It can affect the intestines and cause severe diarrhea, severe respiratory distress, and in as many as 5, 7, 8% of people, they'll end up in the hospital because of the severity of the illness. The problem isn't how many people get the not very bad variety of this, is how many people get the very serious and dangerous variety that will cause you to be hospitalized. When I say variety, I'm just talking about how it clinically presents. The severity of illness is the same germ that causes the mild illness. It's the same germ that, for whatever reason, causes a different person to be extremely ill. And as we all know, this is something that tends to affect sicker or older people. And that is why there was such a high priority of protecting the elderly and the vulnerable, people with chronic diseases that make them sicker and more vulnerable to this virus.
So yeah, I think it's, thing you hit on there, it's definitely, it's unique and it's hard. I mean, it's hard to predict for. I know, at least for myself, it's like, well, the one individual shows no symptoms, and they're surprised by a positive test if they have a test at all, and then the other individual that's the same age, similar lifestyle, is in the hospital and at a very high risk, and that's scary.
It seems very capricious how it attacks some people so strongly and others so mildly. I take care of people right now who are at home, still missing work, my age, healthy guys, who was hospitalized for 3 weeks and is still on oxygen 3 months after he got the infection. And so the problem, again, is not the people that don't get sick from it. The problem are the 5 to 8, 9% of people that get severely ill from it.
So, so the next thing to, from that point on, we have this incredible risk, and so they've pushed out these vaccines. There's options, and the news has been all over the different things. So what can you tell us about the vaccines? Well,
there's 3 vaccines. One is made by Pfizer, one is made by Moderna, and the other is a Johnson & Johnson product. The Pfizer and Moderna vaccines came on the market first with the first emergency use authorization from the FDA, and they've been around since, Pfizer's been around since last December, and Moderna shortly after that. What separates these immunizations is the Pfizer and Moderna use a very interesting technique called an mRNA vaccine. Now, these things aren't actually new, although this is the first time that they've been used in broad populations. They've actually been on the books and getting tested and looked after for a decade or more. And in fact, a part of these vaccines was being researched as cures for cancer. They were kind of the cancer vaccines being developed when the coronavirus hit. And some very intelligent researchers realized that they could use this technology to create a vaccine against this virus. And so Pfizer and Moderna both have that technology. The Johnson & Johnson is a little bit different. It's got a little bit more traditional vaccine use, but it's actually a live virus that's an adenovirus. And this adenovirus has been altered so that it can't cause severe infection in the human body. And the adenovirus is what delivers the particle that allows our body to then develop immunity against the coronavirus. So one of the advantages of that Pfizer and Moderna is you don't have some other infectious agent getting in your body, like with the Johnson & Johnson. Something to consider, especially with how widely available the Pfizer and Moderna vaccines are.
Okay, and that was kind of one of the questions I've had, is that the Pfizer Moderna, I know, is a slightly different method, or relatively speaking newer compared to the traditional style, and I think that's given some people some concern. And so with you say that's been around for a decade or more. I mean, is there any reason to be concerned with that newer method of vaccine?
Yeah, it's a great question, and I think that the main concern is simply, it just hasn't been around all that long, although a decade is a pretty long time. And these things have been involved in studies, and there haven't been any major problems associated with it in the decade that they've been around, looking at it, again, for other purposes. But as it's been applied to the coronavirus, it has turned out to be a very safe and effective vaccine.
That's good to know. And I know, as as you said, we kind of opened up. You have kids in the system, and I know your daughter's in one of my classes, and so you've got your own kids that are in that age group that is they can get the vaccine, and so that's you're not concerned at all in that aspect.
No, all three of my kids have had the vaccine, and speaking of my daughter that's here at the school, she was ready to get hers as soon as she was eligible. She had it within days.
Well, that's excellent. That's good to hear, because I know I've had some folks ask me what my thoughts are, and I haven't, hadn't done a lot of research on it, so it's good to hear that opinion.
Yeah.
Recently, I think the FDA has further approved the Pfizer vaccine, or there's been a different stamp of approval at this point. What does that mean?
Yeah. So the reality is we're dealing with a worldwide pandemic, and we have to figure out what tools we have to protect people to fight against this thing. And immunization is one of those most effective tools at slowing down the spread and keeping people protected from the severity of illness that this can cause in some people. And so the emergency use authorization does not occur until after these vaccines have been vetted in proper trials. Medications and vaccines cannot come to the market without going through several studies. First, you have to prove that they're safe. And then once you've proved that they're safe, you have to prove that they are effective. And only after you establish safety and effectiveness can you then go on and request an authorization for its use. And because of the pandemic, that emergency use was granted because the safety and effectiveness was demonstrated. The only part that was really bypassed, there wasn't any scientific aspect that was bypassed. It was the bureaucratic process that was bypassed, and that's all that's happened. The scientific part led to the emergency use. They said, we're going to go ahead and start now, and now Pfizer has been through the bureaucratic process and has gotten its formal approvals, which is why it just recently got full approval from the FDA.
Okay, that makes sense. I think we all wish we could bypass various forms of bureaucracy if we could. So that brings us kind of to current, and the big one out right now. We have Delta to discuss.
Yeah.
And so tell me about Delta.
So Delta is different than what we faced last winter. The germ that we faced last winter had a certain transmissibility, how easy it was to jump from me, who's infected, to you, who's not infected. And there's a number that epidemiologists will put on that transmissibility. And that transmissibility is, on average, if you're just living in a community, how many people would catch it?
Okay.
If you were to have it. So that virus was a 2.5. between 2 and 3 people for every person that was infected would catch it. Okay?
And that's a pretty serious number. I mean,
that's a pretty serious number. That if you don't do anything about that, that's why the concern was so strong early on, before it was anywhere and anybody was really getting sick from it. They're like, man, when this thing takes off, it's going to be a problem, which in fact it was. So this Delta is an 8 to 9. So for every person who gets it, if you're not wearing masks and distancing and doing all that kind of stuff, on average, 8 to 9 people will get infected for each person who has it. And that's what makes this different from last year's germ. It is much more contagious.
That's a big jump. That's a big number difference.
It's a big jump.
And so, obviously, with a move from 2.5 to 8 or 9 or 8, you would see cases climbing. And so, you're the Randolph County Health Officer. What are we seeing here in Randolph County? So
that's exactly what we're seeing, just in our county. I'm not looking at the state of Indiana, but what's happening here mirrors what's happening in the state of Indiana. So just to give you an idea about this, we can take a look. I've got the trend in cases, which if we can show that, you can see the sharpness with which it's increasing. And in our county, in the middle of July, we had about a 8 or 9 day stretch where we had 0 cases. So we had in excess of a week. We talk about something called a case rate, which you just add up all the cases in the week, and you take that number and you say, if we had a 100,000 person population, how many cases would that be? And so I like to talk in terms of case rates, because then you can compare Randolph County to Indianapolis to Fort Wayne to any other county, rural or urban or suburban, because you're talking the same denominator, the same number of people. So just to give you some numbers, mid-July, our case rate was 0. And then in early August 1st, about 36.
Okay.
36 cases per 100,000 people. Then a week later, August 8th, 89. Week later, 125. Last week, 381. And I just looked at the numbers, and we're going to be just under 500 cases per 100,000 when it gets posted on this Wednesday.
Goodness. And that explains that sharp spike we're seeing on the chart in the trending cases.
Now, a part of what's important about what's happening right now is not just a spike in cases. We were seeing little ups and downs, waxing and waning in number of cases. And the smaller your county, of course, the more that is kind of exaggerated. You see a few cases, then you don't have any for a while. And the question is, so how are hospitalizations doing? And
sure.
So when we were seeing an increase in cases over the spring, as the immunizations were coming out and people were getting vaccinated, we didn't see a big jump in death. We didn't see a big jump in hospitalization. So we saw a little uptick in cases, but not really an increase in death. Now, with this, there's so many more cases, and it's spreading so rapidly that hospitalizations are now going up. And if you look at the Indiana hospital admissions, you'll see that we are exceeding the halfway mark of where we were at the absolute worst of last winter's surge and wave. So we are on a steep rise, not only in cases, but also in terms of hospitalization. In our county, since we've had this, 4 weeks of increase in Delta, we've had 2 deaths in county, and we have had, and one of those was a young woman in her 40s. We have had, a half a dozen hospitalizations. I think we have 2 or 3 residents hospitalized right now.
Wow, that's definitely a concern. What other data or information do you want to share with us? I know there's a couple more slides, but I just kind of want to give you the chance to kind of talk about different things.
If you want to take a look at cases by age group, what is remarkable is when you look at the August 1st rising of cases, and this is splitting out now, 0 to 19, 20 to 29, you're going to see a huge jump in cases in that 0 to 19 group. In fact, what also sets this Delta wave apart is that a much higher percentage of young people are affected. By young people, I'm talking, kids, school-age kids. There's a higher percentage of folks in their 20s and in that 0 to 19 group relative to the total proportion of people getting infected.
And that's definitely different, because I remember, as we, the first wave, it was, younger folks didn't seem to be nearly as affected.
That's right. The people that were affected by far was in that 65 and over group, and they seem to be disproportionately getting those infections and getting harmed by those infections. And what we're seeing now is that a much higher percentage of younger folks is getting infected with this current Delta wave.
All right. So with all this information, with all the things that we're seeing, and with Delta being as the spreading situation being such extreme, and the data, what can we do? Where are we?
And that's the question. So where do we go with this? And the first thing that I want to emphasize is that this information should not cause fear. We shouldn't fear this. The message that I want to give is that despite the fact that cases are going up, fear does nothing to change that. What it is an indication for is a time for action. We need to do something about it. And the do something, there's just 3 or 4 things that are very basic, things that we already know about. The first is, if you have been on the fence about vaccinations, I would urge you to go ahead and get it. The reality is the best way through the pandemic is by having the most amount of immunity against the virus. And the best and quickest way to get there is through vaccination. It doesn't just protect you, but it reduces the spread of this virus. I do want to say, though, that there are many people that not only are they adamantly against the COVID vaccine, they're against any vaccines, and that's okay. I don't want to suggest that people who do not have faith or trust in vaccines, I'm not encouraging them to go out and get it. I respect that position. There are other things that can be done, and we know all about them. The first is wearing masks. Masking does work. There are just so many scientific studies that have demonstrated the effectiveness of masking. Just as some examples, just by looking at the last year, I would point to the schools where everybody was wearing a mask, everybody was distancing, everybody was hand sanitizing, following the rules, and spread in schools last year was minimal. The second thing is influenza. We just about didn't have a flu season last year. There was, on average, there's between 22 to 35,000 deaths every year in the United States during flu season. There was less than 1,000 last year.
Oh, wow.
The flu season just practically didn't exist. Why? Because everybody was wearing masks. The same things that reduced the spread of COVID, reduced the spread of influenza. Just a simple evidence of its excellent effectiveness. In fact, you can look at a lot of these studies. You can go to CDC and just kind of Google CDC mask evidence, and there's an excellent discussion with a listing of a dozen studies that look at the effectiveness of masking. The third is keeping your distance. Look, I think that masking indoors is essential. However, masking outdoors is not needed. When you're outdoors, you've got a lot of space around you. You've got a lot of the circulation of air that makes it so that particles don't hit you the way that they do indoors. So keeping that 6-foot distance between people when you're outdoors or indoors is extremely helpful. The viruses pass through droplets, and droplets have weight. They fall. Okay, so the closer you are, the more likely you are to be hit by them. The more air circulation and ventilation, the less likely you're to be hit by them. So Don't wear your mask when you're outdoors running and cycling, exercising, or taking a walk in the park. Wear it when you're indoors at Walmart or any public building. The last thing is hand sanitation. So the virus does not spread easily from surfaces. However, high-touch surfaces can get the virus. Somebody sneezes, they get it on the doorknob, you can get it on your hand, but the reality is it doesn't spread easily that way because it's respiratory droplets that get on your nose, mouth, or in your eyes. But if your hands are on the doorknob and then you take your hands and you touch your eyes or touch your nose or touch your mouth, that is how it can spread. So it's not so much the deep clean is what keeps it from spreading. It's just simply putting a little sanitizer on your hands frequently. That's enough to keep it from spreading, even if it's on surfaces that are around you. So the things we've been talking about all along: wear a mask, keep that 6-foot distance, hand sanitize, and that does more for mitigating the spread than anything else. They're all low tech, all simple, not comfortable, not fun, not easy, but low tech, simple, and safe.
Because I know we're all tired of wearing masks and all of the things that we have to do to try to keep this mitigated. Though I know there are plenty of folks out there that really enjoyed the 6-foot+ rule and not having people right up next to them, and some that really enjoyed being home away from people in that space. And so I understand that, but yeah, as uncomfortable as masks are, it sounds like this is not the time. With the data we're seeing, this is not the time to get complacent and totally put those away.
Yes. It's simply a balance between examining what's the downside. And I agree, I don't like wearing masks. It's not comfortable, not fun, but it is simple, low cost, low tech, and really effective. And it's weighed against the value and benefit, which is not just for me, but it's for everybody else that's around me in reducing that spread.
And so, we've also heard, some things about breakthrough cases. We've heard, and then that gets used to fuel, if I'm going to still get sick or get COVID and I get the vaccine, then why bother? So what do we know about breakthrough cases?
Yeah, so that's a very valid logic right there. The issue is this. The vaccine reduces the likelihood that you're going to get it. But there's nothing in life that's 100%. The initial studies looked at how well does it protect you against getting sick from COVID? And the answer was 95, 96%. Okay? Well, that means 4 or 5% of people are getting sick from COVID when they've had the vaccine, even in these trials. That's what 95, 96% effectiveness means. So there are going to be some people who, yes, get sick from it. But here's the issue. If you look at who's getting hospitalized, if you look at who's dying, it's almost exclusively the unvaccinated group of people. A breakthrough case is when somebody actually gets COVID-19 despite the fact that they've had a vaccination. And if you look at cases right now in Indiana, about 90% of the cases are from unvaccinated people. 10% are unvaccinated. So that's what we're seeing as far as breakthrough. But the real issue is if you look at who's getting COVID, if you look at this graphic here, among the fully vaccinated, it is a tiny number of people who are getting breakthrough cases. So I'll just look at these numbers here. The fully vaccinated population in Indiana is 3 million people. Breakthrough cases, 10,000. Okay?
Wow.
Breakthrough hospitalizations, 270 out of 3 million vaccinated people. And breakthrough deaths in the state of Indiana, 83. So we're talking 0.00000 of a percentage point of the vaccinated population that are actually either A, getting the virus, but what it really shines, where the vaccine really shines, is keeping you from being hospitalized or dying from it. And really, remember at the beginning of the conversation, it's like, well, okay, what's the big deal if it's just, a bad cold or flu? Well, that's the way it is for most people, but not for the other 10%. Okay? So what we're doing is by getting vaccinated, we're almost eliminating that 10% that are getting hospitalized or who end up dying from it.
Gotcha. And so, it's some of this is just that, that bit of social responsibility that is not necessarily pleasant or comfortable, but you've got to do to help the people that are around you.
Yeah, that's one way of looking at it.
We've covered a lot of statistics, a lot of information. Ken, are there other things that you want to make sure people out there are information they're getting, questions that I haven't asked that it's important to you that I want to share? I know we did touch base on, those that are not in favor of the vaccine or that are still concerned, and that is totally acceptable, and that's understandable. It's your choice. Look at the information and make your decision. There's nothing wrong with that. But what other items or things that you brought here today that you want to make sure that we get out or get shared?
Yeah, I guess there's one more thing that I would like to encourage people in, and it really doesn't have to do with COVID per se. There are some folks that are not just don't like masks, but they don't believe in the data that supports their use. And that's okay. I am not here to tell people what to believe. I'm only here to point people to the evidence and data so that they can explore it themselves. And I respect a view that says, hey, I don't believe in this and I'm not going to do it. Okay, I get that. Vaccines, same way. But this has become something where if you don't believe what I believe, whether that's pro-mask or anti-mask, pro-vaccine or anti-vaccine, COVID believer or COVID denier, doesn't matter. It doesn't matter. What does matter is that we live in the same society and we live in the same community together. And we can have divergent beliefs without hurling hatred at one another. And so if there's one thing that I could encourage every member of Randolph County and our neighborhoods is to say, listen, believe what you're going to believe. Understand that it's okay if people believe something different from you. That doesn't mean you have to hate them. I would urge everybody to be simply kind, respectful, and loving for those that have divergent views from theirs. It's not that it's not a right or wrong thing. These are just people's beliefs. And what is critically important is that we as a community will be stronger, not if we convince people to our side, but if we're at least loving and kind, whether they believe what we believe or not. And that goes for everybody. We will be a stronger, safer, and better community if we are kind and loving to people that believe things different than the way we believe. And so that would be my parting shot, that we are all a part of a community where we are all part of the same, family, Randolph County family, and that we need to be loving, kind, and treat each other with respect.
I think that's huge, because there's been a lot of tension, and whether that's political or just societal or whatever, that involved COVID or that it rolled into COVID.
Yeah.
And so I think that right there is huge. We don't all have to agree on everything, but just to be kind and respectful to everyone. And when you've got strong beliefs about things and you really feel like that's supported, that can be hard sometimes. But chances are that's not going to sell your perspective. That's not going to sell your side of the story. Usually it's going to alienate folks.
Right. And quite frankly, it's okay not to all believe the same thing.
Right.
It's okay. But we do owe each other respect and kindness.
Well, I think that's excellent. That's huge. And Ken, I really appreciate you coming on. I know this is, this, we just mentioned this can be a really pretty charged topic. This can be, in lots of different ways, and it can be scary. And so that we don't need to be afraid, but we need to do our best to protect ourselves and protect our fellow man. And so I appreciate that. What's a good place to keep our thumb on this, or thumb on the pulse, or whatever? Because there's lots of different information out there. Probably not Facebook and what your uncle said, but where's a good place to get information?
Yeah, I think the gold standard is the CDC, and they've got great information there. It's up to date and it's very accurate, and they post a lot of the studies as an evidence for kind of what they're recommending. I think the ISDH or IDOH has some excellent information. You can go to coronavirus.in.gov. I would trust places like Mayo Clinic or Johns Hopkins, Cleveland Clinic. If you go explore their websites, they're going to have lots of great information about this. I think that those are very reliable sources of information and data.
Excellent. That was the Indiana Department of Health and the Ohio Department of Health you mentioned, right?
CDC, ISDH, Mayo Clinic, okay. Johns Hopkins.
Okay. Well, fantastic. And again, thank you for coming on and spending your time. And it's late in the evening. I know you worked all day, and you were running tests, and you were in the trenches. And so
I was doing coronavirus all day long up in Adams County. I probably swabbed 14 people in addition to my normal clinic indoors. And coronavirus is not just rising dramatically in Randolph. It's in Jay, and it's in Adams and Wells County, and I'm seeing it all over the place.
Okay, and so as much as we're all tired, it's not time to give up on this or ignore it or whatever. And so again, thank you for coming, and thanks for making us a part of your evening or day or whenever you're tuning into this. We'll get this out as quickly as we can, because I know this information changes rapidly. So you should see this episode shortly after it's been shot. Thank you again, and have a good one.